आपके यहाँ अटेंडेंस नहीं लेते हो यहाँ पर?
जी सर,
टीचर्स अटेंडेंस यहाँ नहीं है आपके यहाँ?
नहीं वो अटेंडेंस तो इसी में वो हो जाती है
आई नो,
और
मतलब नहीं
वो वही है।
तो शायद बीच में कोई क्लासेस की प्रॉब्लम हो रही है।
हाँ जी हाँ जी, नहीं वो तो इससे देख सकते हैं होगी।
धीरे से डालना टूटे। धीरे से बताया ना, तो आप हड़बड़ी कर दिए। फिर हमें दिया करो। हाँ, उस पर कुछ दिया करो।
इसमें ये इसका वो लगा होता है ना,
आ गए, छोड़ दो।
आगे
हाँ,
स्टार्ट हो गया क्या? अभी तो कोई है नहीं आप। हाँ वो तो मैंने कर दिया।
अच्छा
ठीक है।
से स्टार्ट कर लेते हैं।
और
इसे ऑन है।
जी जी, और
थैंक यू। Dear students, welcome you all in today's class, and today's class is on the very important topic in my view, application of software for statistical analysis. These days often there are misuses of statistical softwares. So what I have planned to emphasize few of the issues which might help you to do the analysis if you want to do on your own. Now, under this, first of all, I would like to tell you that the use of software is involved at many phases. You can say while data collection, nowadays we can do it using on the tablets in the field, even in the clinic, anywhere you are sitting. Then softwares are used in data management like Excel, Access, so many programs are there, and then comes on the analysis of the data. Now issue here is, if we want to use any software to go for analysis, our target should be first to ensure that the data whatever is collected, certainly we cannot check the accuracy because it is already recorded, but at least you can see that whether data is managed properly or not. And many a time I will be sharing few of the incidences while talking on these issues, that the many time what happens, like you got the data collected and handed over to somebody else to go for data entry, and in the process what might have happened, that the hemoglobin level is entered at the column where the occupational categories need to be, or vice versa. So now issue here is, ideally the occupational categories had to be there at column, but point is by mistake the hemoglobin level is recorded, or ideally hemoglobin level had to be there, and due to change in the shift in columns the occupational categories are listed. So now point here is, if you blindly analyze the data without looking into what are they, there will be problem. So message is that we need to be very clear about data set first. What all we have in the data file, which I am going to analyze it. That should be the focus of data analyst. Now there, certainly at the data management level, whatever SOPs are written to be followed by the those who are involved in the data collection, as well as those who are involved in the scrutiny of the data, as well as those who are involved in the data management. There are steps which are clearly defined generally, and we keep emphasizing the importance of these tasks, because until unless everything is written, tomorrow it might happen that the person who was involved in the task, he has left the project and nobody knows what is entered at column this and what is entered at that column that. So now all these details, if they are documented, they are written in register, or even soft copy also is prepared and very well documented, that the what are the SOPs for data collection, what are the SOPs for data management, and then accordingly you can check it. Any new person joining the project or being part of the ongoing research project can go through and then cross check in the soft copy of the data and get well acquainted. That is the point one has to remember, that we need to be well acquainted which column has got which information, and then only the question comes that we are ready for data analysis. Now, before going blindly for data analysis or using the software, there are certain points which I will highlight for your benefit, that even if you are not analyzing and somebody else is helping you, that you can notice that whether the procedure is proper or not, whether there is likelihood that whatever analysis we are going to do, it might turn up to be totally inaccurate. So now, to avoid those issues, we have to be very clear further. Now, what are those points? I think we already discussed many of the points in the earlier classes, that every time we deal with a given data set, we have to be well acquainted about the objective with which data collection was done, with which the study was planned and data collection was done. Because ultimately, the data collected for a specific objective can answer the questions of those objectives only. Whatever additional we do, it is known as the secondary data analysis, means you can subgroup analysis, and those analysis certainly you will get some observations, but they cannot be of any use to make the statement. Rather, they will be helping us to derive the questions and to go for further studies and planning. But if a study has got multiple objectives and planning was done because each of the objective was taken as a primary objective, then at the planning stage, if every objective has been taken care of, certainly the detailed analysis can take care of while analyzing the data. So those issues we have to be very, very clear. Design of the studies are there. As I introduced in the previous lecture, there are certain study design, whether we have got the cross-sectional study, or we have got the case control design, or we have got the cohort design. We have to be very clear, because there are many points which will guide us to go for a specific data analysis. Because in many of the, like if we are not aware that data is of cohort study and event might be in the form of the time to event, we can go directly to analyze like in the form of the dichotomous category, and whole analysis might be questionable. So these kind of issues can be taken care of if we are clear about what design of the study was opted under the study for data collection. So that issue we have to be very clear, and many a time even analytical method might be common regardless of the study design. Like if follow-up is same under the cohort study, and if outcome is dichotomous, for example, then logistic regression analysis you can use regardless of the study design, whether it is cohort study or it is case control design or it is the cross-sectional study. Only at the time of interpretation, study design will certainly guide in what language, in what way we need to interpret the analytical results. but analysis will be same because your outcome was the dichotomous. So likewise, in many situations, the study design might help us to go for more accurate data analysis. Now another issue here is, everywhere, every time, every lecture, we keep emphasizing on the role of the scales of measurement. Like outcome, I told you in the previous lecture, depending on the scale of measurement of outcome, whether it is dichotomous or it is quantitative outcome or it is time to event outcome, our analytical method will rely. Because if it is dichotomous, we have to go for logistic regression analysis. If our outcome is quantitative, we can go for linear regression, but certainly we have to assess the related assumptions, whether those assumptions are fulfilled or not. If linearity assumptions are not fulfilled, then certainly we can look for the non-linear regression, which is not taught to you, but certainly given the need, we can always look for the alternative methods. One message has to be very clear in your mind as a student, because this is the correct stage. You should never think that there is question which cannot be answered by the statistical methodologies. Always there is an alternative. A statistician has come with alternative approaches. When certain assumptions which are required under a specific analytical method are not fulfilled, certainly there is an alternative method. And those issues we can deal with while playing with the data. Because that is what I keep telling. Whenever you are going to use the package, you start with the understanding of the data, means you start with the descriptive statistics. And descriptive statistics means certainly it involves the consideration of a scale of measurement. If it is quantitative, certainly you will go for the mean standard deviation and all this. But if it is categorical, certainly one has to go with frequency and relative percentage. Whether it is row wise or column, all these things you might have been taught. The issue here is, while we are sitting for data analysis to use the package, we have to be very clear which variables should be of which form. And this is a very big job. It is not that the blindly, because one study has taken in this format, I can take that. Maybe that study is conducted on the adults and you have conducted a study on children. You have conducted a study on a specific group of patients like cancer. So depending on the area and type of the data, we have to finalize the scale of measurement of every covariate. So whether it is qualitative, nominal or ordinal, or it is quantitative, play with the data, explore what original form of the data we have and which form we need. Like many of the quantitative variables like systolic blood pressure, diastolic blood pressure, you may not prefer to retain it in the quantitative form, because you may argue that to treat the patient I need to know the people who have got the systolic blood pressure above so and so level, 140 or 150 or 130, depending on the required threshold. But certainly, as you know, we keep talking under the topic of the scale of measurement, that once you change the scale of measurement, we are likely to lose some of the information. And certainly that is true in this situation also. But while analyzing the data, play from all angle, original form, then you change one scale of measurement, again see, then another form, considering the clinical aspect as well, because clinical issues are very important. Blind data analysis is, I think, never advised. At least I never would say that you keep running program and run everything. Reason becomes, like even today, you may laugh, but even today few of the articles which are submitted by the state medical colleges researchers still have all nuisance in the article, like mean and standard deviation of gender. Can you believe? Mean and standard deviation of occupational categories. So these kind of errors, nobody will accept that you are not aware, you don't know it. Only message what we get it is casual approach. Means we have got a data set, we have got a statistical package and blindly run it, all descriptive statistics, and dump it in the report and article. So that should not be the scope. You have to choose For how many variable we need to retain their original form of quantitative form, and for them you calculate, you analyze through packages all descriptive statistics applicable in case of quantitative variable like minimum, maximum values, then all measures of location, median, first quartile, third quartile, because if data is skewed you have to report the median and quartile range, and but if data is symmetrical, not very skewed, then we need to report the mean and standard deviation. So means it is better while running descriptive statistics you run everything for quantitative variable, but for qualitative variable, because depending on the sample size, sometime you may be forced to change the categories. Like occupational categories you have got, let us say 12 categories. Educational categories, let us say you have got 7 or 8 categories, depending on the level of education, number of years of schooling. But point is, sample size is so small, let us say 30 or 20, and if you want to divide them into 7 categories and 12 categories, hardly you will get 1 and 0 people in one category. So now, because of that reason, we have to keep on exploring the change in the scale of measurement, and these things need to be done while you are going to use the statistical packages, because looking at the original frequency distribution and in consultation with the subject expert, I mean that whether you are dealing with the data on the respiratory, whether you are dealing with the cancer data, whether you are dealing with the cardiac patient, depending on those clinical considerations, we can make change in scale of measurement. So I think these things, certainly you cannot directly jump on the final analysis without taking into account these issues. And if you do that, our data will be full of distortion. Whatever analysis result we get, that will be full of error. As I told you, even you may also end up reporting mean and standard deviation of the qualitative categories, categorical variable like gender, like occupational categories. So we need to avoid. And that is the reason I keep telling that if you are not in position to do the justice with the data, you are not able to understand what kind of data we have got it, what analysis is appropriate, better you continue with the biostatistician. Those who are well acquainted with these kind of considerations, and they are there to help you. So these issues you have to be very clear. Now another issue while dealing with the data analysis after scale of measurement are finalized for every covariate, question comes of the completeness of the data. Like one variable is available on the whole sample size, another variable is available only on the 90% sample, third variable is only available on the 80% sample, and likewise. Now question is, if your planning is to use the package to run the regression, for example, regression will use only those individuals record who have got data on every covariate. So now problem is, those where you have got the missing problem means even missing problem is present on one variable, those individuals will be dropped from the data analysis. So now issue here is, if incompleteness of the data is too high, let us say 20% versus 80%, below 5% people can accept that there might not be the systematic incompleteness in your data. But if it is too high, 10% and more, there are statistical approaches. Now how to analyze that? You have to first consider the records where you have got the complete data set, every variable is reported, and then you have to see where you have got the incomplete data. And then if you start comparing each of the variable between these two sets, where variable A is absent, where variable B is absent, and you compare it, you may justify, you may explore, and you can make the statement that those records which are missing, it is not systematic. Means whatever missing problem is there in our data set, it is random. It is not a very systematic, like peculiar group of people have not reported, or peculiar group of people are not tested for so and so parameter. So those exploration you have to do at the planning, at the analytical beginning stage, after you have finalized the scale of measurement. And now question comes, until unless you recall about the study population, certainly you cannot do justice with the analysis. Like, what is our objective virtually to analyze any data set? The data set which is available on a subsample, certainly our ultimate goal is, depending on the objective with which data was recorded, once we analyze the data, we will be tempting to generalize the analytical results on the study population. Now issue here is, if our study sample is not representative, because you have got the totally different sample than the study population, like average age, our sample is little younger in comparison to our study population. Like you are dealing with the geriatric group even, and then the 90% people are very close to the year 50 years. In these situations, generalization of the findings become questionable. So what we need to do, while dealing with the descriptive statistics, we have to keep our eyes open as an analyst when we are playing with the data, that whatever descriptive statistics we are getting, it looks to be in a normal way what we could have got otherwise about the study population, because depending on the objective we will be aware about what study population we are looking for, what is the age group, what is the gender, what is the disease group, and all these. So these issues we have to get acquainted fully before running the advanced packages for the data analysis. Another component under the data analysis is minimum sample size. Now let us say you have got the data set in the field of psychiatry, and generally in those areas are pain clinic, and where what happens, the data set you have got on the, let us say, 30 individuals, but variables you have got 90 and 100. Now in those situations, certainly while running the package, before running the package, we have to think over what approach, how I should proceed for data analysis, because accordingly you can choose the module under the statistical packages. And now basic issues under this kind of situation becomes what? You have to reduce the number of covariates. So now there are certain methodologies, as I told you in the one of the lecture, multivariate methods, like you can use the principal component analysis, you can use the factor analysis to use the number of covariates, because those factors, generally they call it factors. Factors are made of a subgroup of the covariates. Like out of 90 variable, maybe that you have got 3 or 4 factors. Now every factor is a function of around 20 to 25 covariates. Now question is, as I told you, if you remember, I told you sometime, those factors may be of no use, because like if one of the factor has every covariate related to socioeconomic variable, then certainly you can deal with the socioeconomic aspect. If some of the factor are a function of the covariates related to environment, means environmental factor, then certainly you can feel comfortable to address that factor as an environmental factor. But many a time you get distortion. Few of the environmental factors can join the first factor where the socioeconomic factors are there, covariates are there. So likewise, you have to play with the data, you have to explore the data and how to go for meaningful consideration, and accordingly you will reduce the number of covariates because of the smaller sample size. And now once you get the ambiguity in the descriptive statistics, certainly we have to recall what sampling methodology was used. Like majority of the PG students, what you are doing, generally you will be doing data collection on the day you are posted at a particular OPD and clinic, and generally we get tempted to report it that we selected these patients using this and this sampling methodology, but we know it that it is not feasible for you. and generally we keep raising these issues. How can you ensure that you could use this sampling methodology? You have collected data on the day you are posted to this OPD and clinic. So likewise you have to think over about the representativeness of the data, because that will help you to go for running with the specific analysis and generalization of the finding. Because ultimately, considering any data set as a gold and running the statistical packages blindly and trying to generalize the any analytical result we get without taking into account all these aspects, I think is not advisable. And it will unnecessarily attract many queries and questions. Believe me, many of the PG dissertation unnecessarily attract questions and queries because of the no transparency in the reporting. How did we do, how did we plan, how did we collect the data, who did data collection on which day and among whom. So all these steps we have to be very, very clear. And certainly, because the moment if you are getting the contrary finding, like some of us notice that it seems to be the contrary to what is reported in the literature, then certainly how will we critically analyzing it? We have to look into the methodology under both, under the reported literature and under our methodology, whether they have gone on the same way. Because strictly speaking, if two studies have adopted two different methodology, we are not allowed to compare. And that is what we keep telling. Blind reporting of finding is never advisable. What we have to do it, first we should do the critical appraisal in terms of the methodology. How this article 1 was conducted, how this article 2 was conducted. And same way, once we are sitting to analyze our data, to use the package, we have to be very clear how this data was recorded. And remember, in one of the lecture I mentioned that until unless we have used the random sampling to select the patient, or we have done the random allocation of the patient under randomized control trial, strictly speaking, we are not allowed to use these statistical methods for data analysis. But generally you will notice that we keep compromising with the plea that the yes, we can explore. There is no harm in exploring it. And that virtually turns to be the analysis of the 100% data. Whatever we get, we keep analyzing. But if you are exploring with the help of the analytical method, with the help of the statistical package, you have to remember always that while making the statement on the analytical method, you should not forget, because generally we have seen that we forget while interpreting the analytical result. So we have to remember. I think we cannot do that. Missing data, no response. This is the major problem. Like completeness, I told you already. This is other part. That if no response is too high, means whatever sample size is screened, we did the screening, but everybody did not respond to join the study. Virtually as a researcher, we should question ourselves. Is it not that those who are not agreeing to participate in our study, they belong to some specific category? Because until unless we question these kind of issues in the process of playing with the data, because to understand the data we have to play with the data, and that is part of the analysis of the data. So now how to do that? We have to explore comparative appraisal between those variables of the missing regards and the complete regards which are available on both. Because generally maybe the preliminary data is available, age and gender is available, disease status is available, so at least you can explore that those who did not continue under the study, their age, sex and disease status is not different than those who have consented and they participated in the study. So these issues we have to always focus, because analysis is not just a magic that blindly you run the package on any data set without taking into account these aspects what I am telling. Because these issues we have to be very clear. Until unless we are very clear, analysis has no meaning. Analytical results will be full of the distortion. and it will be difficult to interpretation of the result. So now once you have dealt with those aspects, you have finalized that you have reorganized the data in a way that this sub-data set can be used for the further analysis. Then now question comes again about the understanding of data, because now you are going to sit on the specific data analysis depending on the objective of the study. Now you have to ask again, if you are doing what was our outcome variable, and generally I would say the first analysis should be guided by the primary outcome first. Secondary outcomes are just exploratory because they will be full of limitation. Generally in clinical studies what we advise, you write the primary objective where you are in position to do the study on a larger sample size. But secondary objective like to record the data on the clinical variable, if kits are very costly, like some of the studies, I would say one of the PhD student, I generally keep quoting that study, inclusion of one patient in the study had involvement of around 80-85,000 rupees because of the requirement of the estimated parameters. In those situations, certainly the secondary outcomes, whatever exploration we do, that becomes totally exploration. Even if you have got the data on 5 individuals, you can describe it. You have got data on 10 individuals, you can explore it and report it, because they are all secondary. But primary outcome need to be relatively on a larger sample size, and I would say minimum sample size whatever is calculated, that is exploratory sample size, and even PG students are not in position to do that sample size. It is only for a training, because tomorrow you will become consultant and you should not think that the way I did the dissertation, that is the research to create the evidence. No. Evidence creation takes time. Like maybe that you may have to continue study in a multicentric form because you cannot get the patients, enough patients at one center, number one. Number two, even if you involve the multicentric study, because of the larger sample size calculated under the minimum requirement, you cannot complete the study within a year or 2 years. Then there also you have to go in those manner. So now issue here is, if you see, I will advise you, if you can look on the Google and you do the search MRC trial, any drug development, you will see that because of the sample size requirement, those studies are not completed before 10 to 15 years. And that is what we keep questioning, quoting the example reasonably, just to encourage you that the creation of evidence, whether drug is effective or not, like in this COVID-19 era, we are talking about whether vaccine is effective or not. And now even general public is aware about what is the trial, what is the meaning of trial. Trial means any drug or vaccine needs to be tested before it goes in day-to-day clinical practice use. So now issue here is, in view of that, we have to be very clear what are the primary variable outcome, and then exposure variable here means in case of drug development or the vaccine development, vaccine is the exposure variable. Whether the vaccine is going to be effective in terms of the well-decided outcome, drug is going to be effective in terms of the well-decided outcome or not. And how do we do it? You will be taught once you join the PG program. If you are attending the talks on the research methodology on the randomized control trial, this whole discussion will take place. But the issue here is, virtually once you are sitting to analyze the data, certainly we have to be very, very objective. What form of the outcome variable we need to take? Ad hoc approach doesn't work. I have seen, because you are not clear and your outcome originally is in the quantitative form, so you may say that I will take first analysis I will do in the quantitative form, and another time I will categorize it. This is not the way. The analysis has to be driven by the way you have put in your protocol. Because like if you are specifically if you are doing the randomized control trial, everything is well defined in the protocol. Go and see the protocol and then only try to run the statistical packages, because blindly you should not analyze the data. Means what outcome variable form has been planned, same way what form of the exposure variable was formed, and then along with this consideration of all other variable, like we start with the age of the patient, gender of the patient. Many of the diseases have got the gender differential, like many of the diseases are very high among the women, many of the diseases might be higher side among the men. So those issues, these means gender and age are well known confounders for many of the diseases. So now which form of the variable I need to take while adjusting them, adjusting the result and the outcome in relation to these variables. And I will advise you, while you are going with the advanced analysis, all those variables which are being taken to adjust the analysis, they can be taken in their original form, like quantitative variables in terms of quantitative, because our intention is not to interpret the result in relation to those covariates. Our intention is to interpret the results in relation to only vaccine or drug related to specific outcome. So now we need only adjustment. So why not to retain them in the original form? That should be the, I think, as a rule of thumb to deal with. So packages, while running the statistical packages, you will be asked what is your outcome variable, which form you need to keep it, what form of the exposure variable you need to keep it, and then what are the confounders. Then among confounders there are various terminologies. Those exploration, collinearity, the effect modifiers, all those exploration has to be done before you run the final modeling, final analysis of the data. So those issues you have to be very clear. Now another issue here is, at the time of running the statistical packages, I will advise you to make sure that the data entry, whatever way it is done, while data is being analyzed, you can find out the way that the whatever tables are being generated, name of the variable are listed, not in the coded form, variable 1, variable 2, variable 3. We always prefer to deal with the name of the variable, because this will help even indirectly accuracy in the reporting of the analytical result. Because many a time, if you are following the number of variable like 15th variable, 16th variable, and if you convert into the name of the variable, there is chance that you may commit mistake. 15th variable was occupational category and 16th variable was hemoglobin, for example, and you might have reversed the name of the variable. This should not happen. Now coming to the diagrammatic presentation of data, I have seen that many a time your whatever computer output you generate, the number of diagrams equates with the number of tables, and it is not advisable. You remember the lectures on these topics during third semester, if you have attended the lecture, that is the point. And issue here is, there are certain basic principles, means which form of the tabular presentation I should have, means a specific table number, a specific title of the table, and depending on the content in the table, we have to write the title of the table. Same way in diagrammatic presentation, in addition to these principles, we have to make sure that how many diagrams, which diagram I need to report in our report and article. And accordingly, don't create the pollution, because if you generate 100 diagrams and unnecessarily you print it, which is going to be of no use, there is no point. So once you have got the data in tabular form, finalize your tabular presentation of the data, talk to your preceptor and guide, or sit in the group with your friends, debate it on, and then decide which are the interesting findings, which I need to emphasize using diagrams, because use of the diagram is recommended in a specific case, like you have got a very interesting finding, you want to highlight, or you have got a very contradictory finding, something opposite to the what is reported in the literature, and you want to highlight in your report and article, and you want to debate on this issue, then also you have to deal with the diagram. So message is, while you are using statistical packages, be choosy. How many diagrams, which specific diagram I need to generate. It is not that you run everything blindly. No, I will never suggest that. So you have to be very clear, and even if somebody is going to help you, you have to advise in this way that I need only 1 or 2 diagram or 3 diagram, because in articles it is better to include article and dissertation, to include the diagram which you are going to address while writing the article and report. Many a time we come across, you have presented the data in tabular form and diagrams, but while writing you have not touched them. So these kind of tables and diagrams should be not part of your report and dissertation. So ideally, why to generate? Because you have got the access to the statistical package? No. So at the time of analysis, these issues need to be considered. And then certainly question comes, which univariable analysis? Because many a time, many of the data set, you might have got many of the variables which are of no use. So generally, as a researcher, research methodologist, we advise, we should not collect data on the variables which are of no use from your clinical angle, which you are not intending to use at the time of analysis. So even those kind of variables which if they are part of the data set, you should drop in the first instance. You should reorganize the data considering taking only those covariates which you are going to consider in the data analysis. And then another issue is very important. As I told you in one of the lecture, is statistical and clinical significance. And these statistical clinical significance need to be written at the planning stage, because analysis need to be guided by the written protocol. Exactly the way you have written in the protocol, and to answer those queries and question, you need to analyze the data. And how will we come across? To analyze the data set, always demand your protocol, anybody's protocol. If you are coming to anybody, you are going to anybody for discussion, always keep handy your protocol, because things are accurate. Because if you explain correctly, completely, that this is how with this objective study was planned, this is how the data was recorded, then only correct analysis will be done. One example I will quote it here. Like one data set you have got on the 1,000 people, and in 1,000 people you are recording data on disease status and literacy status. Later on, taking 1,000 people attending a particular OPD, and then virtually you are analyzing means disease status versus literacy status, and then your research question is what? Whether disease is associated with literacy level or not. And certainly you are going to use the contingency form of the chi-square table, because all these topics we will discuss in 3rd semester. This is what I keep emphasizing every time in my talk, that until unless there is emergency, try to not miss a single lecture. This is a boon for you people. You have got all these classes, so that once you join your PG program, your life becomes very comfortable. And even I keep emphasizing that the guide and advise your youngsters to do this, to practice, to go for good practices. Attend the lectures as much as you can, because this will strengthen your position. Never look for immediate need, that I need to pass the exam and what all I need to study. No. Then I think you are going to miss too much. Your whole purpose of joining this program, MBBS program at AIIMS, gets defeated, because AIIMS means your training program has to be totally different, quality level has to be totally different. Once you stand and you say I am from AIIMS, it should get reflected on your face. I keep encouraging because you are just like our kids. You have to go for good practices. Now on 1000 I gave you that example. Now another study design somebody else has done on 1000 again, same disease status. But what he did, he took 500 diseased and 500 non-diseased, and then he collected data on the literacy status. Now again he will use the chi-square test, same table, same analysis method. Now problem is that once you are going to use a statistical package, if you use the chi-square contingency table, computer is not going to recall and tell that this data set was recorded in the form of the first study design, like consider 1000 and then record data on the disease status and literacy, and our second study design, like you take 500 disease and 500 non-disease. Computer is not going to tell. Statistical packages are not going to tell us. And what will tell? Our study protocol. And these things will guide you at the time of interpretation, like same chi-square test you have done. If you remember, if you have attended the lectures, you will realize that the first design you can make a statement in terms of association, whether disease is associated with literacy. But in second design what we have to do? Whether literacy level is comparable among diseased and non-diseased or not. We cannot test the hypothesis whether disease is associated with literacy or not. So these issues need to be always recalled at the time of analysis, because blind analysis, I never discourage. If you are good in methodology, if you can remember everything, I will be first to say you go and use the statistical package. But I don't think you will be able to, because you are all often so busy in multitasking that hardly you have got a time to think on these lines. So it is better to sit with the biostatistician, tell details, go with protocol, share everything in one sitting, two sitting. Like these days we are doing these things through communication, virtual, through emails. We can keep discussing, make it clear, so that whole analysis is guided correctly, because that is what the issue we have to remember. So now, after getting the p-value significance, those issues, computer is not going to tell us which level I need to take. How will we decide? What we promise in the protocol. So those issues we have to, because why carrying the protocol with you is important every time. This is what the point I wanted to highlight. Always go with the written protocol, and then everything is clear, then we can go for the multivariable analysis. Like we talk about the dependent variable outcome, then choose the regression method. I think one of the lecture we discussed which regression method in the third semester, the multilinear regression or the logistic regression or time to event regression. Then decide, you have already finalized the variables scales of measurement. Then you subject every covariate with your outcome to begin with. How these individual variables are associated with your outcome variable. This we call it bivariate data analysis. And then those who are significantly associated with outcome variable and with your exposure variable. Like exposure I told you, vaccine and drug. And then outcome is means cure rate or the improvement in the biological markers, like improvement in blood pressure, improvement in sugar level. So whatever, it depends on your objective. You relate every covariate with each of the objective to begin with. And then you will see that the sum of the variables are significantly associated at 5%. But some of the variables are associated at higher level. So now you have to recall what we discussed in third semester, that for model building, epidemiological model building, there are certain steps, and those steps need to be followed while running the statistical package. It is not that blindly we can run the package and everything will fall the diamond. No. And collinearity is the other issue we have to remember among the covariates. Means you do the bivariate analysis among the covariates, and if correlation coefficient is 70% or more, means they are highly collinear, and in the model building you take one of them. I think all these issues we discuss in third semester while talking on the model building, regression models, and these issues we have to remember, and then accordingly you can find out the final model, because while running the package our goal is what is our final model for a given study on the specific data set, and then if necessary we can use the the validity of the developed models. These issues we have to be very clear. So now these issues we have already debated. In case of quantitative variable, how to run the program, create the descriptive statistics, go for the testing of hypothesis one by one, then you go on the advanced analysis until you go on the regression model. If your outcome is dichotomous, you start with the frequency proportion, then run the chi-square contingency or Fisher-Zizek test. If pair data is, go for McNamara test, and likewise you have to choose the module under statistical packages and go on running until you reach to the model building. Means if dichotomous data is there, logistic model you will be using. Same way, if you have got the time to event model and you are aware about the data set, you have to go for the survival analysis, time to event modeling, and there you have to start with the Kaplan-Meier as we discuss in third semester, and then you go on the hazard modeling. So these steps are very clear, very specific, and we need to go on doing one by one. So message for you is that to run the statistical packages we have to be totally acquainted with the statistical methodologies for a given data set, for a specific outcome, for a specific objective, which analytical method I need to use. So if you are comfortable, you use it. If you are not comfortable, don't try to use on your own, because your analytical analysis will be totally full of error. Now to run the statistical software, there are very many certain nomenclatures which may not be same under each software. Like regression approach, there are broadly 4 types of regression approaches. Any regression model we are trying to use, there is approach all possible regression method, forward regression approach, backward regression approach, and stepwise regression approach. Best approach is the all possible regression approach. This was available under the statistical packages BMDP. Earlier our institute had, our department had, when I joined the department, BMDP package was gifted under one of the research project of the RPC, and there you could run, and that program used to run overnight, 12 hours, 16 hours, 18 hours, because the program will start with the model of one covariate, model for every set of the 2 covariates, then every set of 3 covariates, and likewise. So depending on number of covariates it will keep running, and based on the criteria it will come out one model, that this is the model which is the optimal model. But there are alternative approaches. Forward regression means you start with one, then add the other one, then again go back and see whether earlier excluded variable was important for the model building or not. So these approaches, as we discuss in the third semester, we have to be well acquainted. But virtually, just for your information, once you are running the statistical packages on your own, given the choice, stepwise regression approach need to be preferred, because we have done the research that the stepwise regression, which involves both forward and backward both, this approach gives us the result at par with the all possible regression approach. Many a time same regression approach may not give the same result under 2 statistical packages, 2 software. Like somebody is using SPSS, somebody is using SysStat, or somebody is using Stata, we might get different output. A reason for that is the one package is using one method of estimation, another package might be using the another method of estimation. So now you have to be well acquainted. Why are we getting different result? So these issues we have to be very clear, and that is why I keep telling that you are not aware about these approaches means better to continue with the biostatistician who is part of your study since planning stage. Same way there are many issues as a default in the model building, like inclusion of the variable, exclusion of the variable, level of significance is 10 to 15%, let us say, as a default value. But you want to keep 5 and 10%, so you have to change it. And every time I have seen nobody bothers. Generally you run the package and report whatever you have got it. So I think you have to be very clear that these components one has to recall, and accordingly you have to choose the package. Now another issue here is one package may not help us to complete the whole required analysis, and in those situations many a time we need to use more than one statistical package. So those issues we will come across once we are dealing with a given data set with a specific objective and primary outcome. So these issues we have to be very clear, and these points we already discussed. I think how to interpret the result, those issues after the analysis we have to be very clear. Now summary point, as of today, as I told you, no computer statistical program can decide the basic issues related to appropriate biostatistical analytical method. No computer will tell us for this data, for this outcome you need to run this program. Even if you run the wrong package, wrong program, wrong module in a given package, computer will generate the output. That we have to remember. If methodologically not compatible, as I told you, try to continue with the biostatistician involved from planning stage. Biostatistician need to be involved from planning stage, not at the analysis stage alone. Remember, because this is the culture of AIIMS, and that is why we talk about the quality research. Because those who don't consider, because now even system is made in a way that you have to involve biostatistician from planning stage if you need your protocol to be approved. So at PG level, so those issues we are practicing here. So you are lucky, now you cannot avoid. Methods of data analysis generally rely on research question, study design and type of data. I have already told you with example. So accordingly these issues need to be taken care of at the time of data analysis. After appropriate data analysis, even in method of data analysis is same as I gave you the example of the chi-square testing. Interpretation of result mainly rely on study design and other issues involved in carrying out the study. So this is all I have to tell you, and accordingly these points you need to take care if you are seeking to apply a statistical package for data analysis. So thank you very much. If there are any queries and questions, you are most welcome, as I keep telling always. Thank you very much.
चलो सर ठीक है।
क्या चीज?
आज फिनिश हो गया ना आपका?
हमें आइडिया नहीं है, शेड्यूल देखा नहीं है सर।
26 का भी
हैं?
26 तो नहीं है, यही है लास्ट।
हमें याद नहीं
उसमें देखा
तो आएंगे, शेड्यूल हमने देखा नहीं।
शेड्यूल में तो नहीं है ना। आज मैंने देख लिया, मैंने कहा देखता हूँ क्योंकि सिर्फ आपकी क्लास के लिए आ रहा हूँ, सारी क्लासें वो हो गई।
ओके,
सब ऑनलाइन ले रहे हैं ना। अच्छा से बैठ के ऑनलाइन मैं है सीसीएम वालों के थ्रू। हाँ, तो वो पूरा सीसीएम
नहीं, अब
जुलाई से अभी तक
कोई चलिए प्रॉब्लम नहीं किया कि घर को क्या होता है, प्रॉब्लम होती है। हम दूसरी वेबिनार, जैसे अभी कल है वेबिनार हमारा, हम घर से करेंगे, बट इसको रिस्क इसलिए नहीं लेते, शेड्यूल लेक्चर में कोई प्रॉब्लम, लाइटें चली गई तो यहाँ तो रहेगा, तो आप अवेयर हो कि नहीं वो प्रॉब्लम थी। हाँ, तो इसलिए हमने कहा कि बेटर है कि हम यहाँ आ जाएंगे। थैंक यू।